A very good evening to you, and I'm really glad that I am having this conversation with you. I think in these trying times when we have battled so hard, when we have kept our cool and our confidence and we are winning the battle against COVID-19, I think more and more knowledge is only going to make us stronger and is going to help us win this battle even more easily. So really happy to be able to do this live with you. Share it if it makes sense to you, because what you learn in the next 15 minutes may add a lot of value and may ease your anxieties. Yes, you would agree that a big part of wellness is not being stressed, because especially with this COVID-19 and the complications of COVID-19, I am sure a lot of people are facing tremendous stress. Many times we don't know what to expect because there is so much uncertainty. People who are suffering from the disease or even simple fevers, there is a lot of stress as in what might happen to themselves, how their entire families may be inconvenienced. So awareness of all this as a doctor, and of course as a person who has seen so many friends, so many near and dear ones battle with this problem and come out victorious, I think it is my duty to make you aware of what are the skin and hair complications of coronavirus disease. Yes, post-COVID, there are some skin and hair complications, and today in the next 12 to 15 minutes, I would like to tell you about these complications and how you can easily conquer them. Your stress regarding these complications will go down, and you will know what are the exact action steps you need to take if you have any skin or hair concerns after a COVID-19 infection. Interesting, isn't it? Request you to share this video to as many people as possible, because a lot of people you care about are suffering from this disease, have suffered from this disease, and they do have skin and hair complications, and these facts is going to help them take the right decision. These facts are going to help them be less anxious. So we will talk about two common skin complications and one hair complication that men and women often see after COVID-19. So the hair complication is excessive or terrible hair loss. So you might have heard a lot of people who said that after fever, yes, their sense of smell is compromised, they're feeling very weak. Along with all those things, they also say that they are facing terrible hair fall, excessive hair fall, and never before hair fall. Yes, it is worrying them. Most people, when they see that kind of a hair fall, that terrible kind of a hair fall, they tend to express it in a way that I think I am going bald. So that is the kind of messages we've been getting. That is the kind of clients who've been visiting us and saying that after the infection, in fact after 10 to 15 days of the infection, some terrible kind of hair fall started, and this hair fall is causing them to panic about the health of their hair. This hair fall, which comes after COVID-19, is called as telogeneffluvium. The technical name is not important, but those of you who like to understand the details, I am sharing for them too. And it is a diffuse hair loss which is seen after any kind of acute illness. So after many fevers or many acute illnesses, after a surgery, even after a pregnancy, many people go through this form of hair fall known as telogeneffluvium, where there is a diffuse hair loss, sudden onset diffuse hair loss. In COVID-19, this hair loss is terrible or is too excessive, but then the good news is there's nothing to really worry about this kind of hair fall. What I mean when I say there is nothing to really worry is this kind of hair fall does not cause hair thinning or baldness or irreversible damage. If you take the right steps, if you keep your nutrition intact, if you keep your scalp hygiene intact, if your intake of protein, if your intake of essential fats, if your intake of biotin and other B complex vitamins, if zinc, selenium and all these micronutrients which the hair requires to be in perfect health. So if you are able to take a very balanced kind of diet or a hair multivitamin, which either your skin specialist or your general practitioner will also be able to help you with, you will see that within 3 weeks or a maximum of 6 weeks, yes, we need to have a longer window like 3 to 6 weeks because everybody has a different general health, and depending on I'm sorry, there was a problem in the internet connection, and I hope I'm loud and clear all over again. Thank you Urmila for joining in. Thank you Simi. We are talking about complications of COVID infection, and as a skin and hair doctor, I am talking about the common complications that people see in skin and hair, and I am sharing what exactly to do so that people do not panic. They are already in a state of shock, in a state of panic, in a state of depression. So this is a small contribution to give them the step-by-step things that they need to do to get out of these complications which are pretty common after the coronavirus disease. So then we spoke about the hair loss, though it is excessive in nature. We spoke about how it is not something to worry about. It does not cause thinning or baldness, and you just have to keep your nutrition intact. You just have to keep your protein intake intact. I would suggest you take a good multivitamin or a hair multivitamin under the supervision of a doctor. Though these are called as nutraceuticals, I still say that self-medication, though safe, may not be the best idea even when it comes to taking vitamins and nutraceuticals, because there is a particular dosage, there is a particular, if you are taking two different multivitamins, in some cases they should not be taken together because they hamper the absorption of each other. So there are many tiny tweaks that can be made to use the same kind of products and still to get greater results. So I would always recommend that an expert has years of academic knowledge, has years of experience. They will be able to guide you the best. So with the same kind of time and money investment, it is quite possible that under expert supervision you get phenomenal results, and why not make use of those phenomenal results? Makes sense? Now coming to the two common skin problems which I have seen in my clinic Skinsense after COVID infection. I think there is at least one person who comes to us and says, post-COVID I have skin problems. And what are those common problems? One is the skin rash. So COVID is a viral disease, and like many viral diseases, post-COVID infection or even during COVID infection, people get viral rash. This rash is self-limiting, which means that there is nothing to worry. Just make sure that it doesn't go out of control. This rash, which is red, which is itchy, is going to go away by itself if you just keep the body well moisturized, if you drink enough water, if you do not use your nails to scratch it, if you do not over clean it. We all have been using sanitizers for over a year now, and we ourselves know, we have ourselves experienced how dry the alcohol in the sanitizers make us. So please do not over cleanse. A lot of people, when they get a rash, they tend to over cleanse with alcohol based cleansers, which is a very wrong thing to do. So all I request you is, if there is a rash, apply calamine lotion, apply moisturizers, apply anything that feels soothing to it, like maybe a cold cloth or a cold roller. Just do not scratch it too much. Make sure you're comfortable. Of course, there are antihistaminics available which any doctor could prescribe to you. So if it is out of control, please do not struggle, please do not suffer. You can take simple medication if you feel it's very annoying or your daily schedule is getting disturbed because of that rash. but other than that, nothing to panic. These problems are self-limiting, which again I repeat what it means. It means that they start and they stop by themselves. Only you need to make sure that your immunity is good, your nutrition is good, you are treating the body right, and you're not doing anything wrong, and the body is able to get rid of them by yourself. So here I would like to send all of you a message that the body is more capable than you think. You need to trust your body more than you currently trust, because I often see, of course I do not say that be reckless, you must do the right things, you must sanitize, wash your hands regularly, wear a mask, avoid crowded places, we all know this. But what I typically see is either people are taking things too casually, or sometimes they get so paranoid about things. So I think both extremes are equally wrong. Getting paranoid also is going to lower your immune system. So take a breather, trust your body, probably trust the universe, yes, but that's like a different conversation. But trust your body definitely is a powerful conversation, and your body is more powerful or stronger or more intelligent than you think. You only shouldn't mess with the healing part of the body. Makes sense? Thank you, Rosie, for joining in, and thank you, Vinay, for always being kind and encouraging with your words. Now coming to number 3, the commonest skin infection that I have seen post-COVID, and I think it's really important to talk about this skin infection, which is the fungal infection. So we have all seen ads of fungal diseases on TV. In fact, I would take a minute to talk about it. I think a decade ago, there used to be fungal infection ads on TV. I'm sure most of you must have seen it, that yucky looking ads of fungal infection, and then they used to recommend ointments which people can buy on their own and apply. And I think a lot of people were making that choice of not meeting a doctor and self-medicating in case of fungal infections, and because of that, because of over medication, using too strong medication, using medication not for the right amount of time, too little time or too long time, do you know now there is a resistant type of a fungus? People with fungal infections are now not responding to regular medication at all, and this is happening because we have abused the antifungals in the past. Here's a very, very strong message and a very humble request on behalf of all doctors, that refrain from self-medication as much as possible, because many times what you do may not just affect you but may affect the whole generations to come. Like we have, by our own casualness, caused an epidemic of fungal infections which are too difficult to treat. So here I would like to tell you that in COVID, a lot of doctors have to use steroids. So those of you who feel that steroids is a bad word, again, I would like to tell you as a friend, as a professional friend, that steroids are magical medicines, and steroids do have a great role in medicine, a great role in healing. Only that steroids should not be used indiscriminately. So if a doctor is prescribing you a steroid, make sure that you use that steroid only as per the doctor has told you. Do not prescribe what worked for you for somebody else. That's a separate conversation. Thank you for allowing me to share my thoughts. But here I would like to tell you that in COVID, because most of the time steroids are used, and using such heavy doses of steroids can lower the immunity of the body temporarily. So post-COVID fungal infections are very, very common, and these fungal infections should not be treated by over-the-counter creams, because the body's healing, the body's coping mechanism is still a little compromised. For weeks after COVID, the body has too much to repair. So I would request those of you who have either developed a fungal infection post-COVID, or who have had an old fungal infection which has aggravated post-COVID, I would recommend you go to a doctor and you take a 6 to 12 week course to get rid of that fungal infection, to eliminate that fungal infection. COVID does not cause fungal infections, but I have seen that because of steroid usage and because of the body going weak, fungal infections post-COVID are very, very common. So thank you so much for listening to me. This was a technical conversation, but I think very, very important, and I think a lot of people will benefit from it. If you think it was a relevant topic, if you think it was crisp and insightful, I would request you to share it forward or to tag a friend or copy the link and share it with somebody who has recovered from COVID and who may have any of this problem. So Rosie, I think you are like, you're like family to me. It's perfectly all right. We all tend to, take things casually, especially when it comes to skin and hair. We feel that, oh, it's just a skin infection. We'll apply any kind of cream, or rather a cream which worked for somebody else might work for us. But yes, sometimes it works, many times it gives partial results, or it just suppresses the condition. But do not worry. We are fully operational, our clinic is fully operational, and in case you feel that coming to the clinic is not comfortable for you, we have telephonic consultations, we have structured telephonic consultations. So please let me know in what way can I make your skin and hair health, getting back your skin and hair health more easy for you, because at Skinsense we are on a mission to give scientific care and to make skin care and hair care very easy for each one of you. Thank you so much for listening. Rosie, I am waiting to connect with you. Rekha, thank you for being here and thank you for watching my live. Good night to all of you.